We, of course, have many cardiac complications that can arise. The electrocardiogram that we already talked about actually looks at the electrical changes in the heart. The heart rate we look at as being critical. Is your heart racing or is it going too slowly? It needs to be in a normal rhythm. And we look at abnormal rhythms potentially occurring during a heart attack, of course. And many of you now have seen these automatic external defibrillators, maybe in a store. They're all over the place in public spaces. And the idea is it will actually walk you through the process to help restart and shock the heart back into a normal rhythm if someone's having a heart attack. Basically what you're doing is hitting the reset button on the SA node so the heart goes back into normal contractions. Because during a heart attack, what we're actually looking at is the heart muscle failing to rhythm or rhythmically beat when it's supposed to. Now, in some cases, this means the heart muscle has stopped contracting altogether. If the heart muscle stops contracting altogether, the heart stops, and if you don't get it started again quickly, that's the end of that. And that typically is associated with the coronary artery. So coronary is heart, and arteries is away from the heart, right? So how can we have heart vessels that move away from the heart? Well, these are actually the first two arteries that come off of the aortic arch. So if we come up and out of our heart, up and out of the left ventricle, we showed you before that aortic arch, and there are vessels, and they are small arteries that come off of that arch immediately. The first two actually feed the heart muscle. These are the coronary arteries. And I'll show you in a more clear picture in just a second. But the idea is you have to feed the heart muscle. You've got to oxygenate it. And so these vessels, here is the aortic arch. These would be the two coronary arteries that are coming down, and they actually come down around and wrap back and feed the heart muscle. And you see them here, the red being, of course, the oxygenated, the blue, the deoxygenated. And the problem is, if you block those arteries with something like LDL here, or our bad cholesterol, it forms a blockage. The blockage means that if you have a blood clot that comes through and gets stuck because of this blockage, you've now stopped blood flow. If you stop blood flow to part of the heart, the muscle dies nearly immediately. It is so dependent on oxygen-rich blood that we have to get it there all the time. And if you have damaged heart muscle, that means it will stop contracting. So in this case, it's not that the entire heart is stopped contracting, but these pieces of muscle. And you see here, these are associated with the ventricles. So the ventricles in this case may stop beating properly or will not beat as strong. And when that happens, you stop sending blood out to the rest of the body. If you stop sending blood out to the rest of the body, of course, you can end up with all kinds of complications. So the buildup of LDL forms what we call plaque deposits. So if you build up plaque deposits in your heart, a cross-section actually looks like this. This is partially obstructed, so the blood would still be trying to squeeze through this space, and it would do so just fine unless you had a blood clot. The blood clot could get wedged in here, and if the blood clot gets wedged in, then the blood can't flow through, and you end up having a heart attack if it's associated with the coronary arteries in particular. Here is a complete blockage. This, of course, is post-mortem, so this individual died. This blockage, this deposit is so large that it completely blocked the coronary arteries. And when you completely block the coronary arteries, the muscle dies. When the muscle dies, the heart stops contracting. When the heart stops contracting, you die. So these deposits of plaque or fatty acid deposits or LDL deposits within these arteries causes all kinds of chaos. So you can get complete artery blockage pretty quickly from these plaque deposits because the plaque deposits are actually targeted by the immune system for destruction. So you get inflammation and swelling. The problem is inflammation and swelling can lead to tissue rupture. And when the tissues rupture, we get blood clots. Blood clots pass through until they hit a plaque deposit and get stuck. And then when they get stuck, we get the heart. If it's in the coronary arteries, the heart cells stop getting oxygen, the cells die, the muscles die, the heart can't contract strongly. You get what we call ventricular fibrillation, and you get flutters in your heart, and essentially at some point you will get no contraction and sudden death. This is when you hear about the people dropping dead on the 13th hole of the golf course. Just flat out dead. No symptoms. They are just walking along, fall over, and die. These kinds of things are brought on by risk factors. High-fat diets, smoking, lack of exercise. Many of the conditions are now predisposed. They are genetic. So if you have genetic factors that would lead to blood clots, to weak arteries, weak capillaries that are genetic, these things, high-fat diets and so on, will compound that. And as we build up these factors, you certainly can lead very quickly to heart disease. And heart disease is currently the leading killer of Americans. It is not cancer. So that dead muscle tissue, as we talked about, very, very risky, because we end up with poor contractions. Poor contractions decreases the amount of blood pushed around your body. And then if we add to that plaques associated with your capillaries or with any of your small arteries are known as arterioles. Remember, OLES at the end means small. And capillaries, we can very quickly end up with blockages that can cause tissue damage and death.